Schools in Georgia may no longer have to notify students or employees that they were exposed to COVID-19. Good evening. I'm Josh Rowe.
And I'm Kim Chapman. Today, the state updated its quarantine and contact tracing guidelines for schools, and it comes as Governor Kemp urges districts to keep in-person classes in session.
News Channel 9's Chrissy Calcagno digs deeper into the changes as cases spike in the state.
Kids need to be doing in-person learning.
Georgia Governor Kemp just updated the state's COVID-19 guidelines.
So we've adjusted guidance when it comes to contact tracing, not making testing mandatory, but making it available for the schools free of charge.
According to the new guidelines, school employees do not need to quarantine if they were exposed or test positive for the virus, regardless of their vaccination status. This is as long as the staff member wears a mask and does not develop any symptoms. These guidelines are a bit looser compared to the CDC recommendations, which asked school employees to quarantine for 5 days, similar to Tennessee's rules in the classroom.
We're not going to have any restrictions. We have the tools now to fight the virus.
The new law also says contact tracing in schools is now optional, meaning schools don't have to notify other students or employees who are exposed.
If there is a confirmed positive case, then individuals isolate for 5 days and then come back on the 6th.
Dade County Superintendent Josh Engel is following CDC guidance as students return to the classroom this week.
If the employee's asymptomatic and they are okay with coming, we'll ask them to wear a mask. If they don't feel safe coming to school or coming to work, then they will quarantine. And we don't want anybody to feel like they have to be here if they don't feel safe.
The announcement comes as Georgia set a new high for daily cases on Wednesday, recording more than 25,000 cases for the first time ever.
I did miss my friends and teachers and just being with people.
It was a long semester for 6th grader Ellis Olszak. She did online school through Hamilton County's virtual option along with her sister, Hazel.
I got distracted a lot.
Their mom, Jen Pyroth, decided to put the kids through online school because of COVID-19.
I don't have regrets about keeping them out. At the time, it just was not safe.
She doesn't regret it, even when considering how things turned out for Hazel and Ellis.
They actually failed all of their classes this last semester.
But now that Ellis and Hazel are vaccinated like their 2 older siblings, their mom is happy her kids are back in the classroom.
We're just feeling hopeful now and hoping that things, continue to be manageable.
But as Omicron cases continue to rise among the youth, it's causing some medical professionals to express concerns.
This is clearly the beginning of a surge, and we have not seen a drop yet.
We've always said while children are at a lower risk, they are not at no risk.
As of Wednesday, the CDC reports an 80% increase in COVID cases among people 17 and under compared to the week prior. For Pyroth, however, she recognizes Omicron's transmissibility rate, but feels safer than she did during Delta's surge.
It definitely makes me feel like it may be more manageable than it was before, when it was very dangerous.
She recognizes that she's not a medical professional, but says that in her research, Omicron seems to be less dangerous than previous variants.
I felt like just at school that they needed that normalcy.
Doctors say some of those that get hit hardest by COVID are the oldest patients, but one Cleveland family just went through a fight that no parent wants to see their toddler battle.
That was a lot.
Randy Keller is the mother of 2. Her 13-month-old daughter, Piper, was taken to Children's Hospital 2 days after Christmas and tested positive for COVID-19.
She had 104.2 temperature, and they sent us home and said, Motrin, Tylenol, lots of fluids. It's just going around. So we went home. So that was 1 week. And then over the next week, she just kept getting more and more sick.
As Piper struggled in the hospital, her family struggled at home. Her husband, Barrett, is a full-time student, and with her having to take time off from her job to stay with her daughter in the hospital, the stress became even greater.
So we were there for a week, from Monday to Friday. And, I had to take off work for that entire week. So it affected us that way, like financially.
Stories like Piper are happening more often. The CDC reported an 880% increase in COVID hospitalized pediatric patients this week compared to last week. But the youngest patients like Piper is not as common as teens. The Tennessee Health Department also revealed that of all the COVID cases in kids last week, only 12% of them are Piper's age.
Right now, today, she's okay. So that's good. And each day she kind of gets back to herself.
Keller hopes that with sharing her story, she can uplift other parents watching their kids as young as Piper battling this virus.
We can be a part of, helping find some sort of solution, or I don't know. I think it's important.
The family has a GoFundMe set up. If you'd like the information, the link is on our News Channel 9 website.